Hello, dear students. Today we are going to discuss about cytology. So, what is cytology? So, here coming to definition, cytology means the study of cells. There are a lot of cells in human beings. So, coming to normally from the bone marrow itself, we can see different types of cells. First, by starting itself, we can see stem cell. From stem cells, they differentiate into white blood cells, red blood cells, and platelets. Okay. So mainly cytology deals with the study of cells. So what is cytopathology? Cytopathology is nothing but it is a study of normal and abnormal exfoliated cells in the tissue fluid. So what is exfoliation? We'll discuss later. So coming to cytopathology involves examining cells under a microscope to determine their origin, morphology, and any abnormalities. Any abnormalities, if you want to see, we need to have a microscopical examination. Then only we'll come to know what type of abnormality is there in cells. So, is a branch of pathology that studies and diagnose diseases on the cellular level itself. So, used to investigate thyroid lesions, diseases involving sterile body cavities like peritoneal cavity, pleural and cerebrospinal, and wide range of other body sites aid in the diagnosis of cancer. Yeah, any other infectious disease. Okay. So mainly cytopathology is nothing but it is a study of disease cells, abnormal cells. Not only cells, it is abnormal cell study. So under the microscope itself, we use different types of stainings like Giemsa stain is there, May Grunwald's Giemsa stain, MGG stain we call it as, and PAP stain is there. So there are H&E stain is there, hematoxylin and eosin stain. So there are a lot of stains we use for examination of cells. So if you see this picture here, so normal cell, these are the normal cells. And what are the features of normal cells? There is a large cytoplasm and coming to single nucleus and single nucleolus. Okay. Then fine chromatin. Fine chromatin is there. So these are the normal cell features. Coming to abnormal cells, if you see the structure of the abnormal cells, it's entirely differed. So the cytoplasm is there, but it is shape is differed, and nucleus also the shape is differed, and nucleolus again there are some changes, and chromatin is there, and the chromatin itself you can see here light chromatin, again here the dark chromatin is seen. So then you can identify them as in a abnormal cells, and we call them as a cancer cells. So these are the normal cells and these are the abnormal, that means cancer cells. So coming to, already we discussed previously different types of white blood cells. White blood cells, here if you see, it has been divided into 5 types of cells. One is neutrophil, first to respond to bacteria or a virus. And second one is eosinophil, known for their role in allergy symptoms. If eosinophil count is high, so then we can make sure that the patient may be suffering from allergy, yes, some other symptoms. So coming to neutrophils, if the neutrophil count is high, so then we can say that the patient may be suffering from bacterial infection or viral infection. So coming to the basophils, known for their role in asthma. If the patient is suffering from the asthmatic disease, so then the patient may have basophil count high, and at the same time lymphocytes, again large lymphocyte and small lymphocyte, and if you see in a other way of differentiation, there are T lymphocytes and B lymphocytes. So lymphocytes first infections by producing antibodies. Their main role is to fight infections by producing antibodies. So then coming to monocytes, so the main function of monocyte is to clean up dead cells. So there are a lot of cells coming to white blood cells. They have been divided into five, and each cell has a different role to play here. So recently we discussed about exfoliative cytology. What is exfoliative cytology? Based on spontaneous shredding of cells derived from the lining of an organ into a cavity. So contents of the small sample are derived from several sources. So here the definition is there. If you see here, exfoliating is the process of removing dead skin cells from the surface of your skin using a chemical, a granular substance, or exfoliation tool. So your skin naturally sheds dead skin cells to make room for new cells every 30 days or so. Sometimes dead cells don't shed completely, resulting in dry, flaky patches and clogged pores. Exfoliating can help prevent this. So coming to this examples, where do you collect? One is vaginal smear, and one more sputum. Sputum sample also you can collect, and there also you can see the exfoliative cells, and urine sample also you can find exfoliative cells, and CSF also, and other body effusions. So these the materials is collected by spontaneously or by a syringe or a cotton swab. So there are different techniques to collect the sample. We can use those techniques and we collect the samples in different containers. So here, this can help. What is the purpose of collecting the samples and testing? This can help diagnose a variety of conditions, including pap smears. If you see, so what is the purpose of collecting the pap smears? Examines exfoliated cervical cells to detect abnormalities that may indicate cervical cancer. So if the patient may be suffering with the cancer, so that time we need to have a pap smear. So in the pap smear itself, by using a different type of stain like pap smear stain, so then we will come to know that if the patient is having abnormal cells, cancer cells, so then we can diagnose that patient as a cancer to the cervical. So coming to abnormal cells in pap smear may indicate cervical dysplasia or cancer. So pleural fluid analysis. Next is pleural fluid analysis. Here, what is pleural fluid? The pleural fluid, it's a fluid which is surrounded to the lung cavity. Okay. Analyzes fluid from around the lungs to detect abnormal cells that may indicate lung cancer or other infectious diseases. So, malignant cells in pleural fluid may indicate lung cancer or metastasis. So, peritoneal fluid analysis again. Peritoneal fluid will be collected from the abdominal organ. So, analyzes fluid from around the abdominal organs to detect abnormal cells that may indicate cancer or other conditions. So coming to inflammatory cells in cerebrospinal fluid, so may indicate an infection or inflammatory condition. So the presence of abnormal exfoliated cells itself can be crucial clue to in diagnosing and monitoring various diseases. So again, exfoliated cells recently we discussed before it was discussed here. What is exfoliation? Exfoliation is nothing but it is a process of removing dead cells from the surface of any organ like vaginal cervix, yeah, some lungs, yeah, some other urinary tract parts, and coming to CSF, cerebrospinal, where some spinal, in CSF itself, we can see different types of cells. And coming to other body effusions like peritoneal, yeah, pleural, so there also you can see sometimes exfoliated cells. Okay. So common applications of cytopathology. So where are you going to apply here? So pap smear is used to detect precancerous cervical lesions. and prevent cervical cancer. So common application for cancer diagnosis and screening. Cytopathology is frequently used to identify cancerous cells in various body fluids and tissues. So mainly cytopathology purpose is to identify cancerous cells in various body fluids and tissues, aiding in the diagnosis of screening of different cancers, including cervical cancer. We are going to use here as a pap smear and other cancers. So infectious disease diagnosis. Second one is infectious disease diagnosis. Cytopathology can be helpful for to diagnose infections by examining cells for the presence of infectious agents, sometimes some bacterial infection, yeah, some any other type of fungal infection, yeah, any other infection we can identify by using this cytology, any cytopathology techniques. So inflammatory disease diagnosis. So cytopathology can identify inflammation in inflammatory cells and changes in tissues, aiding in the diagnosis of inflammatory conditions. Inflammation, where do you find? So inflammation can be it is an outcome of a infection, a injury, whatever it may be. So that time you are going to see some inflammation in the body, a particular organ. So that time we can diagnose by using clinical pathology. So cytopathology. Thyroid lesion investigation. Cytopathology can be used to investigate thyroid lesions and determine if they are cancerous or benign. So if it is normal, so then we call it as a benign. If it is a cancerous, yeah, any abnormal cells are identified. So in thyroid lesions, we call it as a cancerous thyroid lesion. So then other body cavity diseases. Cytopathology can be used to diagnose diseases affecting specific body cavities such as pleural cavity surrounding the lungs. So early detection of cancer. What is the early detection? So why it is helpful? What is the main purpose of detecting this cancer early? So if you detect cancer early, we can treat easily. So cytopathology plays a vital role in early detection of cancer, particularly through screening methods like pap smear and analysis of breast, nipple discharge, and follow-up of previous diagnosis. So cytopathology is also used as a follow-up method. So here again follow-up method. So why follow-up method? Any disease, any there is a progression in treatment or not, we can identify here. So whether the treatment is helpful or not. So in follow-up itself, we can identify by using the cytopathology whether the disease is reducing or there is any progress in disease. So we can identify and we can treat it properly. So methods in patients with a known cancer diagnosis to assess disease progression or recurrence. So that's the main fund of having cytopathological investigation in a laboratory. So here coming to steps in cytopathology. So sample collection is one first step, and second step is smear preparation, and third is fixation of sample and staining of smear and interpretation. These are the steps involved in cytopathology. So coming to next slide, methods of collection. How are you going to collect specimen? So submit a fresh sample. One case, one jar has to be used. Use fixatives to fix specimen and label them properly. Complete requisition form. So these are the requirements for the collection of a sample. So fixation methods. So there are different types of fixations. One is wet fixation. Second one is spray fixative. Third one is liquid based fixation for pap test. Fourth one is lysing fixation for body samples. So types of fixatives which are we are going to use here. One is 95% ethanol we can use for fixative as a fixative, and second one is 100% methanol, and the third one is isopropyl alcohol, and fourth one is 80% propanol. We can use them as a fixatives in a laboratory to fix the cells. So coming to advantages of dry smear and wet smear. So useful. Dry smears are useful in immediate assessment. Eliminates the fixation step, more rapid assessment. Dried smears are preferable to smears that have been badly fixed and then pap stained. So, what are the advantages of wet smears? So, empirical choice of antibiotics can be made on the basis of gram stains. Report choice of culture media for inoculation can be made empirically. Evaluate the quality of specimen. Correlate the smear findings with that of culture. So, these are the advantages of dry smears and as well as wet smears. So coming to next step is processing of samples. How are you going to process the samples? Ready smears prepared at bedside and wet fixed in methanol. Example, pap smears, FNAC smears can be stained directly. So no need to wait for fixation here. Once they are fixed, we can use staining process and we can use staining method and we can process the smears and we can examine under microscope for abnormal or normal cells. So stains used in cytopathology commonly. One is Papanicolo stain, that is PAP stain, and second one is May Grunwald Jimsa stain, that is MGG stain, and third one is H and E stain, hematoxylin and eosin stain, and fourth one is differential, that quick rapid stain we can use in cytopathology laboratory. So first we are going to discuss about PAP stain. So what are the advantages of pap stain? One is good nuclear details can be identified here to differentiate benign and malignant cells. So main purpose of using pap stain is here to differentiate whether the cells are normal or abnormal cells. So if cells are malignant, so then the doctor, a treating doctor, may start treatment to the patient as per requirement. And coming to the benign, no need to worry there. So the main funda of having the pap smear is pap staining is to differentiate whether the patient is normal or abnormal. Abnormal in the sense if the patient is suffering from the malignant, so then again they need to have a treatment for the particular cancer. Okay. So next, polychrome staining. Differential counter staining may be seen here, and cytoplasmic transparency can be noted here, and clarity of overlapping cells, mucus debris. So here, here two pictures are there. One is normal pap smear. So you can see here, here cytoplasm is there and nucleus is there. And here the cell, you just see this. This is a complete cell. And it's clearly visible and clear. There is no abnormality can be seen. So coming to infected pap smear, these are the infected pap smear cells. You just see here, have a look on that. The entirely, it is a cytoplasm and nucleus are totally inflamed here. So, infected pap smear can be differentiated easily by using a pap staining method. So, what is the procedure? So, coming to procedure, here, dip fixed smear for 3 minutes in tap water. So, before that, we need to collect pap smear. So, that main collection procedure may be dealt by treating gynecologist of a particular patient, where the gynecologist will collect the sample. So those samples will be sent to laboratory by labeling them properly. So those samples will be collected at laboratory and it will be processed. Okay, dip fixed smear for 3 minutes in tap water and blot out excess water from the slide. So second point to be remembered here is dip for 60 seconds in rapid pap nuclear stain. Add 3 drops of Scott's tap water buffer. Wash for 10 seconds. Blot out excess water from the slide. Dip with 2 change in rapid pap. Dehydrate for 30 seconds each. Dip for 40 seconds in working cytoplasm stain. Wash in tap water and blot out excess water from the slide. So if the smear requires mounting, repeat dehydration in a second bath of rapid pap dehydrant for 30 seconds and dry. So dip in xylene, dry and mount with cover glass using a drop of DPX. So mainly we need to remember this procedure. Even the kit contains a booklet where the procedure is mentioned. So we can follow that particular procedure and we can get the smear stained by pap staining. So again, coming to one more method of doing pap stain is liquid-based cytology. So here again, the gynecologist will collect the sample and the sample will be sent to the laboratory where it is centrifuged. Centrifugation is done, and again that particular sample will be sent for slide preparation and staining takes place. The slide is ready to observe under microscope. The under microscope, the picture will be visible like this. Okay, this is the slide. So these are the cells which are visible under microscope. So here you can see aspirate materials with LBC solutions. So maybe it is a FNAC technique. There also you can collect and you can use same technique to stain the sample. So that particular sample is fixed here, and LBC solutions, example cytorich, red solution. This is a solution with the sample, and it is again non-gynic LBC. So it is stained with pap staining. So then integrated diagnosis. Again here the same sample is tested again for immuno staining. Once it is tested, the same sample gets the integrated diagnosis. So again the sample is sent to block preparation. Cell block is prepared. So then the cell block is tested here. Genetic mutation test, RT-PCR, integrated diagnosis is made. So here again this cell block is sent for fish analysis and HND staining. So fish and HND staining, again there is some particular abnormal, a normal diagnosis can be made. So next is fine needle aspiration cytology. What is fine needle aspiration cytology? So one needle is used here to insert in particular wound a lump, so that in the particular swelling a lump, by inserting a needle we are going to collect some sample, a specimen. So that specimen is tested by using some stains. Okay. So once it gets tested, so here we can identify different types of cells. Yeah, some bacterial infections. Yeah, some any other granular matters. So those granuloma, any whatever it may be, the content if you see, so then we'll come to some conclusion. So that conclusion itself, we can diagnose the patient may be suffering from lymphoma, a tuberculosis, yeah, any other disease. Okay. So it is a diagnostic procedure used to investigate lumps or masses. In this technique, a thin hollow needle is inserted into the mass for sampling to collect the sample of cells. That after being stained, we are going to stain the sample, cells, and once it is stained, we are going to examine under a microscope for any abnormal cells. Normally, we can find normal cells. If the patient is having any abnormality, we will see different types of any abnormal cells. So then we will come to some diagnosis, a conclusion by a pathologist. Okay. So FNAC method is typically performed in an outpatient department for sampling masses, not only outpatient, for inpatients also, we do this test. So masses such as those observed in the neck, breast, and diseases like lymphoma, tuberculosis infection, etc. It serves as the initial step in identifying the underlying cause of abnormal swellings. If anywhere in the body, if there is an abnormal swelling, we can use FNAC technique to collect specimen from that abnormal swellings. Once the sample is collected, we can stain the sample, and after having the staining, we can observe under microscope for abnormal cells. Yeah, any other infectious disease. An aspiration cytology test is recommended when a lump is discovered in the breast or neck, these tests is used to determine if the lump is cancerous. Additionally, it is employed in diagnosing thyroid disease, salivary gland disease, and lymph node disease. So here you can see a doctor, a physician, he is using a FNAC gun with the syringe having a needle. He is inserting into the lump and collecting a sample, a specimen. So once he is collected, that specimen is sent to laboratory. Yeah, same specimen is made for sent to made for smears. Yeah, doctor itself he makes smears and he fixes the smear and he send the specimen to laboratory for staining part. So here you can see the FNAC gun with a syringe and needle. So this is how a FNAC fine needle aspiration cytology can be performed in a outpatient department or laboratory. So coming to one more specimen we are going to collect in laboratory, that is sputum specimen. So sputum. So it contains different types of colors when the patient is suffering from any disease, yeah, abnormality. So here you can see different types of sputum colors. One pus is there, yeah, pus cells are there, more are there. Yeah, sometimes blood tinged sputum is there. Yeah, blood filled sputum is there. Because in different diagnosis, any different diseases, we can diagnose here by using a sputum sample. So how are you going to collect the sputums? Rinse his or her mouth with clean water prior to collection of sputum. Early morning, early morning sputum sample resulting from overnight accumulation of secretions is preferred for routine examination. The patient is instructed to cough deeply to get the material from deep inside. The sample is collected in a properly labeled wide-mouthed sterile container, glass or plastic container with a screw cap. So once he collect the sample, he needs to put the cap and tight it. Ideally, the volume should be 3 to 5 ml volume. So poor quality specimens are thin and watery and contain mainly saliva. Mainly saliva. So here if you see the sample, sputum, it is an indicator for lung disease. So any disease related to lungs, we can use a sputum sample to identify disease. So ideal sample, if you see here, this is a ideal sample, thick and sticky it will be. And if you see saliva, thin and watery. So there is a difference between a sputum and saliva. So if it is a saliva, we just discard and we ask the patient to have one more sputum specimen. So ideally we need to collect in early morning, free of contamination by food particles, deep specimen which is thick and not a sample of saliva. Minimum, the quantity already we discussed, 3 to 5 ml is required. In those patients who cannot produce sputum spontaneously by deep coughing, sputum needs to be induced or collected. So, sputum for malignant cells, these are the abnormal cells. So, if you see under microscope such cells, we need to inform a pathologist immediately and we can give the smear to pathologist to observe and report of this abnormal malignant cells. Malignant cells. So coming to sputum sample, it is a mucoid sample and purulent sample. If you see here, it is contains purulent and it is a full of mucus. So mucoid sample, purulent, and it is blood stained sample here. And here, if you see here, So more AFB after having a Zell-Nielsen stain, you can see these are the bacilli observed under microscope. If this type of bacilli is found, so we can say the patient is having infection of AFB, acid fast bacilli, nothing but Mycobacterium tuberculosis. So again, such things, if you note it down in smear, no AFB. So we need to differentiate properly and diagnose them properly. So sputum sample is placed in petri dish and inspected against a dark background. Bloody, discolored or solid particles are removed with wooden applicator sticks and placed on glass slides. So clean glass slides are used to crush the particles, mucus and spread the metal evenly. So here different types of color sputums you can see and identify them. So white, normal, yeah, any allergies or viral infections may be having the white sputum, and yellowish sputum developing an infection. So greenish sputum viral or bacterial infection. So brown sputum, dried blood or heavy smoking. The smokers, we call them as chain smokers. We can see their sputum will be in such type of color, like lightly in brown color. So coming to the red color, bleeding in respiratory tract. So again, this is a microscopical examination. Under the microscopical field, you can see different types of cells and cytoplasm, whatever it may be here. You can see here and here in a petri dish, the sputum sample is spread. So this is how the sputum sample will be collected and examined in medical laboratory. So coming to body fluids, how are you going to collect the body fluids? So what are the body fluids? Mainly pleural fluid, pericardial fluid, peritoneal fluid. These are all body fluids. The procedure is called a tap. We're going to do tap here. Tapping of pleural fluid, tapping of pericardial fluid, tapping of peritoneal fluid. Tapping is nothing but collection of fluid. So it is an invasive procedure to remove fluid from the space of diagnostic purposes. A cannula or hollow needle is carefully introduced, generally after administration of local anesthesia, to be done by doctors only. It's mainly, it will be handled by doctors. Okay. So coming to fluid specimens, large volumes of fluids received are allowed to stand in the refrigerator from half to 1 hour. After that, all except the bottom 200 ml is discarded. The retained fluid is then processed. If specimens containing excessive amounts of blood, erythrocytes may be lysed by the addition of 1 ml glacial acetic acid GAA of 50 ml of specimen. So here techniques again, sediment smears, cytocentrifuge we need to use, yes, cell spin preparation. So here we are going to discuss about pleural fluid. So here you can see what is hydrothorax, pleural effusion we call them. And if you see different types of pleural effusions, it is a hydrothorax. Serous fluid is there here. A normal lung, how it will be? So I think it is a normal lung. And at the same time, this side you can see the fluid is accumulated. Okay. So hemothorax, the blood is there. And it is again, it is a normal lung, it is a abnormal. So pyothorax, pus is there. Okay. Again, it is a chylothorax. Here some chyle material is there. Again, here urinothorax. Urinothorax means what? Urine content is there. Again, here hydropneumothorax. Water is there plus as well as air is there. So the lung is totally, I think if you see here, it has been collapsed. Okay. So again here, it is a normal lung. If you see pneumothorax, blood also is there and air also is there. So these are the abnormal forms of lungs. If you see pneumothorax, here one lung is okay, but one lung is totally, it has been ruptured, and now the here if you see the air is filled here totally, okay. So we need to identify them, and after diagnosis, the sample, the pleural effusion is a condition. If you collect this pleural effusion sample, so what is the condition? Why it is formed? Pleural effusion, why it is noticed that? So it is a condition characterized by abnormal accumulation of fluid between the layers of tissue, pleura lining the lungs and chest. If you see here, it is a lung, it is a lining. Two linings are there. In between, the fluid is accumulated. From externally, if you see, it is a skin, again it is a fat, again it is a muscle, and it is a rib. Okay, ribs are there. So these are the ribs. And after that, one lining is there. After that, the fluid is filled here. So if normally the quantity is, if it is a normal quantity, so then no need to worry. If the fluid content is more, so then it may be called as a pleural effusion. So doctor may remove excess fluid by tapping method. So accumulation of fluid between the layers of tissue, pleura, lining the lungs and chest cavity. This excess fluid can interfere with breathing and cause symptoms like shortness of breath and chest pain. The fluid buildup can result from various underlying conditions. Okay? Underlying conditions. So again here we are going to collect peritoneal fluid. So peritoneal fluid, how are you going to use here? Peritoneal fluid is a lubricating liquid within the abdominal cavity. So produced by the peritoneum, the lining of the abdominal wall and organs. It helps reduce friction between abdominal organs and the abdominal wall. While typically present in small amounts, 5 to 20 ml, a buildup of fluid known as ascites. Okay, ascites. If there is a abnormal fluid content, so we called it as a ascites. So can indicate underlying medical conditions. Analysis of peritoneal fluid, often obtained through paracentesis, abdominal tap. Okay, so can help diagnose the cause of ascites and other conditions. Okay. So again, coming to pericardial fluid. Pericardial fluid is a lubricating, again, it is a lubricating fluid, serous fluid that fills the space between serous pericardium, the inner layer of the heart sac, and the heart itself. This fluid helps to reduce friction as the heart beats and allows the heart to move freely within the pericardial sac. So, healthy heart, pericardial effusion. Pericardium, excess fluid is there. So, coming to one more fluid, we call it as a synovial fluid. It is in the synovial joints. Synovial fluid, also known as joint fluid, is a viscous lubricating liquid found within the cavities of synovial joints. It acts as a cushion and lubricant, reducing friction between bones during movement and providing nutrients to the surrounding cartilage and other joint tissues. So mainly this fluid provides nutrients, and it support it supports the movement and nutrients to surrounding cartilage and other joint tissues. Collection is done by orthopedic surgeons. A small volume of synovial fluid can normally be aspirated from joints up to 1 to 2 ml. So coming to CSF, cerebrospinal fluid. Cerebrospinal fluid is a clear, colorless fluid that surrounds the brain. Mainly, it is surrounded to brain. If you see, this is the fluid, cerebrospinal fluid. Okay, this and all. And it is a clear one, colorless fluid that surrounds the brain and spinal cord. It acts a cushion, protecting these vital organs from injury. CSF also helps nourish the brain and remove waste products. So, CSF cells pathological findings in connection with inflammatory disease of CNS, predominantly granulocytic. So, these are the predominantly, if you see, majorly granulocytes are present with intracellular bacteria. There are bacteria, if you see here, there are a lot of bacteria. And what type of stain we have used here? That is MGG stain, May Grunwald's Giemsa stain. So again, B, predominantly granulocytic cell, picture with intracellular bacteria. Here, we have used here gram stain. Okay. So again, C, lymphomonocytic cell picture with activated lymphocytes. One is plasma cell, two is viral infection. Again, we are using MGG stain. Here, some problem is there. So here, CSF cells pathological findings again. Lymphomonocytic cell picture here. If you see here, lymphomonocytic cell picture with activated lymphocytes. One is plasma cells and with two is viral infection. And the stain used here is MGG stain. Again here, eosinophils are there. Eosinophilic meningitis with parasitic infection. Again, the stain we have used is MGG staining. So this nothing but demonstration of bar bodies, buccal smears. The test identifies a bar body as a round disc stuck to the nuclear membrane in the epithelial cells in female patients. So again, one more specimen we are going to collect here is urine specimen, fresh catheterized specimens are preferred in female patients, while voided urine is satisfactory in males. After initial morning voiding, which is discarded, samples of about 50 to 100 ml are collected on 3 consecutive days. Third one is hydration by forced intake of fluids. 1 glass of water every 30 minutes or 3 hours period is recommended by some workers for production of high volume specimens. So 4, if delay is anticipated in dispatch to the laboratory, the sample should be collected in an equal volume of 50% ethanol. So this is how in laboratory we process samples, okay? In cytology and cytopathology, cytology is nothing but it is a study of normal cells, and cytopathology it's nothing but it is a study of abnormal cells to identify mainly cancer cells or any other infectious agents, okay? Thank you.